Local hospitals are tracking a trend no one wants to see, and that's a spike in pediatric hospitalizations from the recent surge. News 9's Hunter McKee spoke to health officials about that uptick and what the surge means for kids moving forward. Hunter?
Yeah, that's exactly right. This new surge has taken the entire country by storm, and we're seeing its impact right here within the state as hospitalizations continue to climb for adults. Health officials are also seeing a trend in kids as well.
If you look at U.S. hospitalizations for children, they'd gone up about 60% in the 2 weeks before last week.
Dr. Dale Bratzler says today OU Children's has more than 25 kids hospitalized with COVID complications. Compared to their numbers in November, they only had a few cases. He says they're not only seeing it here, but in other states as well.
So they've definitely gone up. I heard a report from Texas Children's Hospital this morning. They too are seeing a substantial increase in the number of kids that are being hospitalized.
In the OSDH weekly update, the 7-day average for overall cases is the highest it's ever been during the pandemic at almost 7,200. The report also shows 37 pediatric hospitalizations.
Remember, kids below the age of 5 can't get vaccinated, and while it's recommended that we vaccinate all kids, 5 and older, there's still a lot of people that have not done so.
Bratzler says there can also be other consequences to children getting the virus. In a recent study, doctors found that kids under 18 who had COVID were more likely to develop diabetes than those who never got the virus.
So again, another reason we need to prevent the disease. We don't want kids getting infected.
And Dr. Bratzler also says it's important for those who can get their vaccine and boosters to get those as soon as possible, especially for those who can't get vaccinated. Live in Northeast Oklahoma City, Hunter McKee, Oklahoma's own News 9.